Hey campers, it's me. Sorry I'm running a little bit behind today, but have had a lot of things going on. And yesterday, when we were out doing our acupuncture at Dr. Lanz's, I didn't want to run a live cast because there was just so much going on. But I did record it so I could share it with you today. And I think you're going to be amazed. It's pretty cool, the way that Dr. Lanz does things. So I'm going to just put my mic right here so you guys can hear everything that's being said. And I'm going to let it roll. And if you have any questions, just feel free to pop those in, and we'll answer them to the best of our ability. Here we go. This is Dr. Karen Lanz, by the way. We are going to have Brady's treatment with Dr. Karen Lanz. He's getting his acupuncture, and he just came from seeing Dr. Royals, who is our wonderful orthopedic doctor at Metropolitan, who saved Emma's life years ago. And so Dr. Lanz just got a huge compliment from Dr. Royals that he really likes acupuncture, which I thought was cool.
Very good.
It is cool. And so he suggested that we continue to do acupuncture. And so Brady's getting his calming
We're
needles
getting a few needles
right now
That's
because
right.
he's been a little hysterical. He got a rigorous examination, which made him a little bit sore, but he's been doing amazingly well since Saturday, Dr. Lanz, and we're so grateful that you got us in when you did.
Yeah. Well,
He hiked his leg, and he's been hiking his leg.
and he's sassier today,
And
which I
he's
like.
very sassy today.
It means I feel better.
Yeah,
to me,
his attitude is much better.
Yeah, brighter in his eyes. I mean,
Yeah.
not that he looked bad last time, like we talked about, but I still feel better. Yeah, so we'll see if these calming needles work.
God, I hope so.
Because where he's a little warm right here, where he had a lot of from his exam, I think it just kind of warmed it up a little bit, just a little more tender. So we're going to use the therapeutic laser on that because right now if I put needles there, he might be okay, but it might be a little more uncomfortable for him. So I'm just going to laser that first, okay? Now he had laser therapy before. Mm-hmm.
They said there were
with him.
There were two numbers. There were two different numbers, 10 and 3 or something. I don't know what they said. 3 and 4. Two different types of laser.
Yeah. So this is the class 3B laser.
Okay.
This is the.
That's what they were using out at Bannon Woods.
Yeah, this one I really like. It's very portable. Some of the class 4s are real big and difficult to be mobile.
That's what they've got it at. They take him in the back to do it at East Louisville.
Yes,
and I don't want to do that. He has to wear laser
He
goggles
has to wear glasses
and stuff.
because this one. I hear you.
Stop.
This one can be.
Stop.
Do you need a cookie?
Stop. No,
I'm gonna
he's
give
probably
you one
being
more,
a bigger
and then
jackass because he's eating cookies. Look at the ears. He's so funny when he does this.
Treats. Okay, we're going to put these away. I'm going to put them over here. All gone.
All gone. All done.
But this one, we will put glasses on for the 3.5 minutes that I treat this area. With him, with this one being used in contact mode back here, he doesn't have to wear glasses.
Good.
So the class 4s, when they're holding him above and moving it, everybody has to wear glasses. So.
Okay, gotcha.
We'll do that. We'll turn it on.
So when we started this little journey, for the benefit of those who are watching, and I'm going to use this probably for Waggin Wednesday tomorrow, we're going to do a video / live cast, because this is Tuesday, and we're going to do it on Waggin Wednesday.
These are for your mommy.
Thank you. When we do our show tomorrow, it will be because I want you to see the impact of acupuncture on a 90-pound dog who has back issues and who has never shown any symptoms of them until this summer when he had a big reaction. He had a little heat exhaustion and he collapsed on his butt end and couldn't get up. And we've had 4 or 5 very serious rounds of that kind of behavior throughout the summer and fall, and this last time was just really terrifying, and thank God Dr. Lanz could get him in. And we've been getting great help out at Bannon Woods with the MagnaWave and the Vetrastim and the chiropractic, but the last couple of times it has seemed like it was just way more acute and he was having real trouble recovering from it. So Dr. Lori Freed at Urban Village recommended that we come in to Dr. Lanz for acupuncture, and since you and I talked about 2 months ago, and you told me how far out you were booked, and I appreciated the fact that we were able to get to see you fairly soon. Your experience obviously is fantastic because he loves you. You made a huge difference in one treatment. And how did you decide that acupuncture and alternative therapies were going to be, the thing that you really wanted to do?
I'm going to keep giving you cookies.
No. Brady, hush. I think I'll come around on the other side while you do that.
Yeah, Mom will come sit with you.
Okay, go ahead. Tell us. Speak.
Well, okay.
Why?
So I was in very traditional practices for many years. I'm going to keep an eye on my laser because it's silent, so I just have to watch the time.
Okay. Coming over here to keep an eye on you, you little booger.
And there were a lot of cases that came in that were like Brady, to where, like, okay, we're doing medicine, the traditional medicine, and the weight control and all these things, but they were still having problems. So then I started looking at alternatives. Okay, what field do I want to look at? Acupuncture, chiropractic. There's so many other, complementary practices that you can do for these guys. And I had a 15-year-old German Shorthair who just had a lot of age issues. She wasn't eating great. She had some stool incontinence. She had some trouble walking. And I had a colleague come and do some acupuncture with her, and it made the last 6 months of her life so much better. The quality of life was so much better. Did it turn her into a 2-year-old? No. Right. Did that decline still occur? Yes. But she was much more comfortable. She just felt better. Yeah. And so that's what clinched it for me to do my acupuncture training first, and then as so many things do, other doors opened, and then you learn about herbal medicine and spinal manipulation and Tui Na, which is massage and acupressure. So there's just all these other things that you can do. So, but that's what got us started. So. Well,
I'm telling you, it was awesome to see the result of what you did the other day, because he literally was not able to hike his leg. Just to change the shot a little bit here. He was unable to hike his leg for like a week or two. And I've noticed it kind of just dropping. I've noticed the leg just kind of getting closer and closer to the ground. And then he just started peeing on his foot, which was terrible. And I felt like he was losing his dignity, and I was getting really upset at that point. And then when you did what you did, it definitely made a difference, because he was like,
standing up
half hike, and he was falling off of his 4 feet, and then he was all of a sudden, able to stand on 3.
We can take off those glasses now. Please ignore my phone.
It's in your pocket. It was. I saw it on your backside somewhere.
I don't know. We'll find it. It'll stop ringing.
What are we doing? He says. What are we doing? What are we doing?
Now we're going to put some more needles in.
So what is involved in the acupuncture training? And you're a veterinarian, obviously. God knows you have enough training in everything. But what did you do to get the acupuncture training?
Well, there are 3 programs in the U.S. For veterinarians, and they're focused on people that are in practice and working all the time. So there's the Chi Institute where I went, which is in Florida, IBIS, which is an International Veterinary Acupuncture Society, and then there's a program through Colorado State. And they're geared for people to come basically on long weekends and throughout the year. Now they do a lot of the lectures online, which is great. Even when I did it, that wasn't even that available. Right. So much things have changed since 2006. Yeah. But that's kind of how it's set up. And then you get your training, and then you have to do a practical exam, a written exam, and then there's also either further education as far as advanced acupuncture training, or doing certification hours with a practicing veterinarian. I've had a number of colleagues come from Lexington and surrounding communities to do their hours with me. So
that's fantastic. So when you did your
become certified.
Yeah, when you did your certification training, were you one of the very first doctors in Kentucky or in Louisville to do acupuncture?
We have a number of acupuncturists here. Yeah, it's really kind of neat. I started in 2008 this practice, and I was the first one that was doing it mobile. But there were some wonderful colleagues here that do acupuncture. So
So when you, this is a great little office too. It's like a sunroom you obviously put on your house, which is really cool. But you come to people who can't get the dogs into the car anymore.
Yeah, I started all mobile, and then the need was just such that where people were calling me from Indiana or Elizabethtown, or it was just too far to
You had
travel.
to get them to you.
So I started looking for a place, and the universe provided this facility.
Yeah.
The mixed zoning, it was just perfect. So it just worked out very well.
You're really close to Escape on Blankenbaker, right? Yeah. Theater. So that's really helpful. So the doctors who do acupuncture, especially in this particular case, you probably don't have a lot of time to do other stuff, veterinary practice, right?
Yeah.
I mean, like for instance, I just felt something on his back leg that makes me think, he's got another mast cell coming up and I'm going to have to get that aspirated.
I need to get that aspirated. So me particularly, I do focus all on acupuncture and what are considered complementary or alternative modalities.
Yes.
But a number of my clients are doing, my colleagues are doing acupuncture in their traditional practice.
Really?
That's how I started. It was kind of like you put one hat on and go, or try to mix it in, and that was sometimes easy and sometimes difficult.
Yeah.
Good boy.
You're such a good boy. You are. Tell us about the actual, you were going to say, look at how they move with his hips.
I was just going to say that one, he twitched a little bit and made a little bit of a face. But he's allowing the needle, but that's an acupuncture point called Jinjiao, which is related to lower back pain. And so for him to feel that, that's very normal, but he's allowing the needle. So it just
and he also just got a big exam from Dr. Royals. And Dr. Royals even said that. He said, he's going to be a little bit sore because he just got poked and prodded quite a bit.
So that tells me, okay, so that needle was sensitive. Let's go ahead and maybe do some little local points here, whether we're on the bladder meridian, which is these, or we can go a little closer in. These points are called Huatou points, so we're going to focus. They're a little closer to the vertebrae of the spine. So
he has always had a small bladder. He's had to pee more frequently than the other two, so I will take him out late, for one last potty quick outside before he goes to bed. And I wonder if that has anything to do with the impingement on the spine.
Well, he has a lot of changes kind of in that lower part where those nerves come off the spinal cord onto the control of that.
He says, "You're not paying enough attention to me, Dr. Lanz. You're talking to my mama, and I need you to pay attention to me."
Yeah, we need about 10 hands.
He loves you. He loves you. He's very good for Dr. Royals too, who is a very nice guy and just super kind and very thorough and he doesn't rush people. And that's always big because you've got a lot of questions. And I didn't even think to tell him about the hiking because I called the office and I said, please tell Dr. Royals that before acupuncture he couldn't hike his leg. And after acupuncture he could. And he's still hiking it, which is really good news.
Very good.
I know. And it's those little things that you just hope for. Mm-hmm. So we took the bed down to the floor, took the box springs out, got rid of the little 3 stairs that we had for the bed, and he's doing okay on the ramp to the car.
Good.
He wasn't for a while. That was really becoming a problem, and then I couldn't let him stand in the back of the car. I had to make him lie down in the back seat, which he did not want to do.
No, they never do.
So now he's standing in the back, which is really good.
Will you let me do that one? He's getting some acupuncture needles in his feet too. These are all focused on pain relief and opening those meridians, moving the energy, getting these legs to communicate better with the ground, so he's not so crouched and he can be stronger. These points tend to be a little more sensitive, so he's really good to let me do those needles.
Yeah, he is really good. And Dr. Royals did the flip test, where he put and he said there was just a little. He called it a little bit more dramatic. It wasn't like boom, 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 boom. It was kind of like boom.
Yeah.
And a little hesitation.
Yeah. And then so that's just like the finesse of doing things, like our brain, our spinal cord, telling what our hands are doing, what our feet are doing. When it's that little bit of a spastic move or delay. Those communications are not quite
Right.
where they're supposed to be.
Right. Well, he was very encouraging about suggesting that we continue with this course of treatment. And he said, you know, there are dogs that get acupuncture that never require surgery. But he also gratefully told me that he had a different dog in mind when he was hearing my vet's report. And he thought it was going to be a much bigger dog that was older and probably at the end of his life if he was more Dane. And he said, this guy's got a lot of life in him. He has a lot of, you know, personality. He's very strong. And he said, you know, if you did decide to do back surgery, it would, you know, he would have several years left to enjoy his life with quality of life. So hopefully we won't get to that point, but at least it's good to know.
It is, and there are cases of my sister's little beagle many years ago, same thing, had chronic disc that was making her real wobbly in the back end, and she had surgery, and she did great for years after that with no symptoms, you know, and she was kind of, you know, middle-aged by then, but she did great. So.
Well, somebody said that he, Dr. Royals was saying, first of all, that they don't fuse dog spines and they don't put cages. Come here, lie down, lie down, lie down.
Good.
They don't put cages on dog spines. They just relieve the pressure.
In there and get that disc material out.
Yep.
Clean it up.
Yeah, and that's the big thing is just, you know, knowing that humans have to go through so much more.
Yes.
There's so much more involved in the process, and that's why I think a lot of problems, you know, repeat themselves because they're dealing with too many different variables. So now we are attaching little tiny itty bitty electrodes.
Yeah, this is called electroacupuncture.
Brady.
Hey, Brady.
Hey. And for the record, he has been doing this since we went into Dr. Royal's office. It's not that he's been doing this with Dr. Lanz.
I think you just want
We couldn't even hear each other talking in the very live rooms, the examination room.
You want food.
No, don't give him any more food.
No, it'll start a terrible...
The cycle will continue. The best chance is at the moment is to scratch his chest and hope that he will be calm.
I do. Yeah. I'll give you some more. Hold on. Okay.
He says, but my mommy never wants to give me treats.
I need my two hands to do this other stuff.
Brady, that's why you are in such good shape, because Mommy doesn't give you treats.
Exactly.
Mommy takes very good care of you and keeps keeps your body in good shape. Mommy doesn't eat a lot of treats either, which is also, you know, it's funny because somebody said to me one time, your animals kind of can represent their humans. And I think sometimes when you've got somebody who runs and who's, you know, fit and does yoga and stuff like that, their dogs are fit and do a lot of down dogs themselves. And so I've always, you know, felt like we all keep each other fit. You know, we all walk a lot and we love to go and run and play and have fun. And that's been a huge part of our lives together, is being outdoors.
Well, and being active is a huge part of, you know, why these guys, why he's his age and just now having these issues.
12 years old.
If he hadn't been fit, it probably would have happened a lot sooner. Or he comes in and he looks like he's, you know, 14, 15 years old because he's, you know, his body's not in good shape to start with, and then this happened. So
nobody can believe that he's 12.
Right.
Or that Gracie's 13, or that Wyatt's 10. And interestingly, Wyatt has, he had to have his toes x-rayed because he had a toe injury. And Dr. Rudwell said, he's got arthritis in all of his little paws.
Yeah.
And I was surprised because he's the jock. You know, he loves to chase the ball. He's always racing after a squirrel. And it's funny because his feet have been his literal Achilles heel. I mean, he tore his pads, you know, he's injured his toes, and
I know, a little pinchy right there.
All of a sudden, you know, he's like 10 years old and he's got arthritis, but it doesn't slow him down. I'm just wondering if acupuncture might be good for that.
Those are the guys that can be helpful. That's where I feel like laser therapy can really help, because I'll get in and get all those toes, because there's so many joints involved if you think about it.
Yeah.
But I'll just get in there and laser all their little toes and foot bones.
What is it
doing?
What is the laser therapy doing?
The laser is it's under a category called photobiomodulation. So they actually, laser light is causing change within the cell, increases oxygen within the cell. It affects the cells at even like at the mitochondrial level.
Wow.
As far as just getting oxygen, getting them a healthier cells. So when you get better blood flow, you get better nourishment to the tissue, calms down pain receptors that are fired up. And so when you get that better blood flow, it's like then things can start to improve, and the chi can move.
Well, he's obviously very happy at this moment because he's finally stopped being an idiot.
So what this is electroacupuncture.
That's exactly what he's doing. You're so funny.
I can see him in the shadow. But this is just, right now it's at a setting that helps endorphin release, your pain, your natural painkillers. And then in a few minutes I'll change it to a different setting that actually helps to stimulate not only longer term pain relievers, but also working on regaining that nerve communication. So that's what's so neat about this electro unit, is you can change the settings depending on what you need. If you have an animal that has a lot of muscle wasting, for instance, which he just does not have a ton of.
You don't think he does? That's good, because I've noticed that his hips look
I mean, you can see, definitely. I mean, it's there, but it's not like an animal that's had an injury, that the muscles have atrophied because of a shoulder injury or something like that.
Do you feel like at this point it would be worth exploring trying to get him hydrotherapy, or not necessary?
I think that is always a good option to look at, because they're exercising. Are you talking about like on the treadmill?
I think that's the only option we would have.
Yeah, because swimming is difficult to find anybody.
He used to love to get in lakes, but the last few times we've gone swimming in lakes, he's barely been able to get out of the water.
That's the problem in a non-controlled environment like that. If you don't have some kind of connection to him and he gets in trouble, but yes, because the treadmill, you're walking against that resistance of water. They're working with him. The Blue Pearl is where they have the hydrotherapy. Dr. Schmidden and her techs are great. They're coming up with a game plan for him and doing it when at his speed and what he needs, not like, let's just push it. No, we're going to do what he needs. So. And then I just kind of watch this and I eke it up to where sometimes I'll see the needles move just a little bit, kind of twitch. I certainly keep it under anything that would be uncomfortable for him, but this is just kind of amplifying what the needles themselves are doing. So.
How long did it take you to learn how to do all of this?
Well, my course was a year. Throughout that year, it went down.
Still quite a trip.
Yeah.
And I think that I wanted to know how the study of Eastern medicine in animals changed your treatment of yourself, and whether it affected the way you would consider Western or Eastern medicine for yourself, for a physical human being.
For sure. And a lot of my clients are interested also in that, and obviously for their pets, but also looking at it for themselves. Because they maybe want some other answers or options for their own health care. So, yes, I go to get acupuncture regularly. I think that and I've done that for years. It really, really helps. There are times where Western medicine is extremely important, trauma situations, things like that, no doubt.
Mast cell tumors.
Infections, mast cell tumors, surgery, if surgery is the answer. And sometimes clients reach out to me and I say, you know what, you're a 90-pound dog and you've torn your cruciate completely.
Yeah.
I think you probably need to go talk to a surgeon, because that's going to be a better option.
Yeah.
Can acupuncture and laser therapy help with the recovery?
Yeah.
Thank you. But yes, I mean, I think it's really helpful. I try to integrate my care.
So that's what they say, integrative care, meaning you're combining the two for the betterment of the whole. And you said the difference is between Eastern and Western medicine is that you're treating the root causes. With Eastern.
Eastern medicine or Chinese medicine tries to look at what's the root imbalance of whatever problem that we're having.
Right.
And many times in Chinese medicine, we can tie together what we look at from Western medicine as separate problems, but in Chinese medicine, they can have the same imbalance that we can work on, whether with acupuncture, herbal medicine, diet changes, things like that. So
that's pretty amazing when you stop to think about it. So if someone were interested in learning what you do, you would recommend, I'm sure, first that there'd be a lot of consideration as to what kind of specialization they would want to go into. If you went to vet school right now and you said, I want to be an acupuncturist, is there a track for that?
It depends on the veterinary school. There are some that have integrated medicine programs for their students, which is really neat, so they can start to explore and learn about these different modalities. So that kind of depends on the school.
I was curious about that.
Yeah. A good friend of mine is the head of the University of Florida rehab program. And they have
at Gainesville?
At Gainesville.
Yeah.
And so that UC Davis, Louisiana State, the different veterinary schools have some programs.
Cool.
So that is really neat. So
yeah.
the students can get exposed to it and then decide, what if they'd like to pursue it or not.
My childhood best friend is an equine surgeon, and so I'm sure that there have been many times in her life that she's had to utilize alternative therapies just because when you grow up in Oregon. My dad used to rub DMSO on us when we'd get an injury, and that's the horse liniment that literally you taste in your mouth as soon as it touches your skin.
You can smell it a mile away.
Oh my gosh, it's just absolutely amazing stuff, and I have no idea whether it causes all kinds of other physical ailments or not, but it helped the bruises for sure. How long do we typically entertain acupuncture? I mean, we spent like an hour and 15 minutes with you total last time, and we're probably going to spend that much time today getting the laser, getting the acupuncture. What is the typical course of treatment for a dog that's acute like he has been?
Well, so this is a little more involved when we're doing electroacupuncture. It takes a little bit longer time, and then we lasered him first because of the local pain.
Brady, hush.
You're almost done.
Hush. He's tired of not getting our undivided attention.
So what I usually tell people when we're starting out with acupuncture is looking at anywhere between 3 and 5 treatments initially.
Okay.
Sometimes
just a few days
together,
apart.
Sometimes a few days apart, depending if they're in a lot of pain or we have an acute issue. More of my chronic arthritis guys, maybe once a week. And then then I try to stretch them out. Sometimes acupuncture is not the answer. Sometimes we're at 2 or 3 treatments and nothing's changing.
Yeah.
Maybe we need to talk about something else. Maybe it's not the answer. But
he had a profound change after
feel,
one.
hopefully they feel better. And
Yep.
then we try to, what kind of maintenance do they need?
Right.
Sometimes it's every 2 weeks. Sometimes average is a month that they come for treatment. It just depends on if it's more arthritis, it's neurological involvement, what exactly we're dealing with. You're funny.
He's been so funny because he's usually very quiet, and then all of a sudden at some point, he did this once in one of the mobile vet trucks, and I'm trying to remember what precipitated it, but all of a sudden he just started barking like a frickin' maniac, and he wouldn't stop. But I'm glad to know that he's feeling better.
I've got a lot to say.
He has a lot to say, and when he's not feeling good, he doesn't say anything. And when he's not feeling good, his mommy can't speak for him, so.
No, I usually I like it when they're sassier, or sometimes they're more wiggly,
Yep.
because they feel better. If they're just really hurting, they're just sitting there like, oh gosh, I don't want to move around. So.
Well, and mine, unfortunately for him, we're very active, and he has not been able to be active, and I think that plays a big role in this, because, he's been kind of stuck in not being able to get out and do the things that he wants to do. But today, thanks to what you did on Saturday, which is like 3 days ago, he was able to get out and go to the park and, look very interested at what was going on around him, and he is full of kisses. Oh my gosh.
Just don't lick my teeth.
Oh, yeah, really. Keep your mouth closed because he'll go for it. He's a big kisser. I appreciate the fact that he's been so responsive to it, but also that the treatment and your treatment of him is so gentle and so encouraging. Because this is something completely new, and other people might not be able to get the same result out of a dog, but your demeanor and the way that you treat the dog is really obvious to me, so I really want to thank you for that.
Oh, you're welcome.
And every time I've mentioned you on Facebook over the last few days, I've gotten all these comments, oh, I love Dr. Lanz. Dr. Lanz has done so much for whatever the dog's name is, and they just love you.
Oh, thank you.
Yeah, so it's good.
This is to me, this is why I've learned this, just to try to help them. And I deal with a lot of older dogs, and sometimes we can get them feeling better for a long time, sometimes a short period of time, but whatever time it is, we're trying to help them. It's all about their quality of life.
Do people ever come in and start treating a dog when they're puppies and do acupuncture all their lives, or is it typically something that's reserved for old age or as a last resort?
We're kind of looking at, we're fixing a problem, and I wish sometimes I think, gosh, if they could have come to me 6 months or a year ago,
yes,
I feel like I could have helped more.
Yeah.
But I do have a number of clients that, as their older dogs have passed on and they get a new dog, they come to
early
me and say, well, or at least for a consult, what can we do about diet? What can we do about supplements? What can we do to try to help them keep them happy? So the day
I think that's great.
Further down the line that they have to come for this.
I love that, the little
song plays
music at the end of his treatment. It's fantastic.
A little sweet Chinese song.
Oh my gosh.
And then we can just take out your needles.
Yay, take my needles out.
We're going to take all your needles out.
And the last thing that I'll do, like we did last time,
look at this.
Acupuncture, so I'll drop a little vitamin B12 and
I think that definitely helped. Somebody said that to me. They said, God, B12 is just amazing.
It is. It helps with nerve communication. How can you go wrong?
Okay. Pulling all of the little needles out. So tonight, he's going to have a lot of relief, and I know he is because he's going to feel so much better
After he gets his B12 shots.
So what I'm going to do is I'm going to scoot over here and I'm going to do a little camera move so that actually people can see the B12 part of it, because I think that would be really cool. And the other day Brady did it. It was in an area of his back that he was feeling a lot of pain, and you helped that.
Yeah, that's what we'll do again. Very similar treatment there. Just a second, you
You've got a
draw
whole
it up.
cabinet full of Chinese medicine, don't you?
I love, yeah.
And some CBD oil, and I've been rubbing the essential oil on him.
Great. Yeah, these are all essential oils and then different herbs and supplements, and then I have more in my office, which don't fit in here.
So what's the purpose of an essential oil?
So that
That was good, Brady.
let me show you what I can do.
You got up a lot more easily that time. That's what we've been struggling with so
Yeah,
much.
yeah, getting up easier, and as he gets up more and easily, it's like what happened to those trees? Look, he's gonna go look for him.
He's gonna go over. See, this is the best part though, is that he just hasn't been interested in anything, and so he's exploring, and that makes me feel good that he cares enough to look around. And his little back legs are straight, not bent, and his attitude, just his posture and everything else is so much more positive. So go outside, stay right here, you're on camera, don't forget, Mommy's doing some TV right now. Mommy's doing some Facebook Live right now, except we're not live. We're recording.
Live on tape.
Come on over.
Come here, sweetie. Come over here. Now, can you sit down again for me? Because you're kind of wiggly. Yeah. Let's start right here. Go ahead and sit. Thank you.
Good boy. Good boy.
Good boy.
Good boy. Okay, so tell us about the B12.
So
What's
what
the
I'm
deal?
doing, this is a little B12, just itty bitty bits in these acupuncture points called Huato Jaiji, and I'm sorry I'm a lefty, so my hand
You're fine.
is probably blocking it. He's twitched just a little bit.
Mm-hmm.
So we did those kind of in that lower lumbar,
Okay.
and then we're going to do a little bit more in these acupuncture points called Jinjiao, which I absolutely adore treating because they help so much. And you can see he doesn't care, B12 doesn't sting.
No.
And that's it. And the last thing I'll do is get a little more of the essential oil, and I'm just going to do a little Tway Na down his back, which is just massage and acupuncture.
Tway Na.
Tway Na. T-Y-N-A.
Tway Na.
One of the branches of Chinese medicine.
He's so interested in whatever it is. Look at him, he's looking over there. What is going on over there? He says. You're going to love this. I just renew this every day.
Picky on what you use. Do not use any essential oil on your animal unless you've discussed it with your veterinarian or you use an animal safe product.
Oh, so you can't use your own
Don't
essential
forget
oils
some
on a
of
dog.
the cabinets that belong to you. No.
Isn't that interesting? Because they're formulated differently.
And I'm just real picky on the quality.
Oh, yeah. So, if you actually did use human products of any kind on an animal, and I understand that, you don't want to give a dog, obviously, like Tylenol.
Correct.
Or human aspirin or things like that. Or
Correct.
Certainly, now you're giving dogs gabapentin, which humans take.
Gabapentin, tramadol, trazodone, fish oil. I mean, there are a lot of things that we do use in animals.
But you don't want to just arbitrarily give a dog human medicine.
No, you need to
Or
check
oils.
with your veterinarian. Absolutely.
Yeah, good deal. That's what we'll do. He says,
You can quit that in 20 minutes, doctor.
Exactly.
Bless you. Bless you. Well, I tell you what, he's in heaven, and I am in heaven as well, getting relief for my boys. So I appreciate you.
Says, oh, yeah.
And we will see you again in how many days, do you think?
Probably. He's doing good, but we'll look at
Just don't want him to lose ground.
3 or 4 days.
Okay,
Yeah.
so
And
Saturday
then,
maybe?
Yeah, we'll have to.
And then we'll get through the holiday.
It'll have to be Friday because
Yeah. Okay.
Then you're going to get through the... What do you see out there? Oh, it's a car. It's headlights.
Maybe somebody who wants to get in where I'm parked because I blocked the driveway.
They'll just have to.
You just have to wait.
Turn it around. Everybody turns around here.
Everybody turns around in the driveway.
You are awesome.
Okay, tell Dr. Lanz how much you appreciate her, Brady.
Because I'm going to appreciate this treat in my mouth.
Dr. Karen Lanz, what's your number?
502-424-6274.
And we can get you on Facebook.
Yes, and Healing Hands Pet Acupuncture. I have a Facebook page too.
Thank you so much.
You're welcome. Merry Christmas.
Oh, I tell you, wasn't that the cutest thing ever? Let me show you my fireplace, you guys. Isn't this cool? That is absolutely the coolest thing ever. So that is the end of our little broadcast for now. And I want to thank you for joining us on this time-delayed Waggin Wednesday because I just didn't want to interfere with Brady's treatment in any way while we were to do a live cast. So I just kind of set the camera up and just let it roll. And it worked out perfectly. And I'm very, very grateful for Dr. Lanz. She has made a tremendous difference in our lives in the last few days because I'm telling you what, on Friday I was just desperate. I spent a good portion of the day crying and just, thought it was the end. And he is not ready to go anywhere. I've heard that now from 2 vets who I'm respecting extraordinarily. Dr. Karen Lanz, one of them who's been giving him the acupuncture, and also Dr. Stephen Royals, who I just think is the greatest thing since sliced bread. He's an amazing guy, and he did a full exam yesterday just as a bit of backup information for what we might need to know, and I wanted to make sure that if we did have to go for surgery that we would have the best, and Dr. Royals to me is the very best. So he said the same thing, Brady is not ready to go anywhere, and that made me feel good. So anyway, this is a great opportunity for you guys to ask questions, and Dr. Lanz will look at the live cast when she's finished with all of her many hours of work, appointment after appointment, and she's booked out about 3 weeks sometimes can take really bad emergency acute situations, as she was kind enough to do with us the first time. But just contact her through Facebook, and she gave you her number. You can roll it back and watch that again. But most of all, just hold your puppies close and let them know how much you love them, because honest to God, it's the most amazing thing to see the difference between a dog who's not feeling well and a dog who's back to 100%. So really appreciate you, Dr. Lanz. Thank you so much. And thanks you guys for watching. I'll be doing a couple of live casts in the next few days. You'll enjoy them, I know. So enjoy yourselves. And we're going to ask you for a little prayer, because we're off to see our vet to get a mast cell, possible mast cell tumor aspiration. We hope that that's not what it is, but it kind of feels like it might be going that direction. So I'll post later and let you know, just say a little prayer. And I'm going to let you say goodbye to the kids. Gracie is right down here in her little bed. Gray, you want to say goodbye? You want to say bye-bye? Where are you? Where are you, Gray? There you are. You're standing in your little bed. There you are. Bray, say bye-bye. Hey. That's all you're going to say? Wyatt? I see you down there in between the chair and... Wyatt, look. Wyatt, look. I see you. Hey. You see his little head? There he is. Wyatt, look. Come here. Look. There you go. There you are. Look. All right. Night, Todd. Glad you joined us at the last minute. You'll have to roll it back and watch it all over again. There comes the Why My. Good boy, Wyatt. Oh, yeah, I get no attention because my brother's the one who's sick. So just wanted to come over here and say, hi, I am the creative director of Puppy Pack Adventures. And I would like you all to know how brilliant I am and how athletic I am as well. So I'll just talk to you later. Wish you all a Merry Christmas, a Happy Hanukkah, Happy Ramahana Kwanzmas. And much love to all of you who are members of Puppy Pack Adventures. I love Waggin Wednesday. Thank you so much. Good night, you guys. Now he's going to go over and lick his brother's face. This truly is worth seeing. I know you guys all have dogs that do this too, but they take such good care of each other. It's hilarious. Off to the vet. Love y'all. Happy Waggin Wednesday.